I am Dr. Mark DuPéré, board-certified plastic surgeon, practicing in both Toronto and Richmond Hill. The demand for labiaplasty has been rising over the last 5 years, due partly to Hollywood and the media, but also with the internet. I believe people are talking more and more about this procedure, and people are becoming more open about labiaplasty. Now, I do approach labiaplasty as I do with other parts of the body. Parts of the labia can get elongated with pregnancies. Some people are also born with asymmetry of the labias. Now, when a patient comes to see me to discuss about labiaplasty, I do like to address the three main areas, which are the mons pubis, the labia majora, and the labia minora. Now, the mons pubis is a common area where fat tends to accumulate over time. So in my older ladies, this is a common area where I will suggest some liposuction and perhaps sometimes a pubic lift. Now, when somebody is concerned about her labias, we do assess both the outer and the inner labia. The outer labia can be treated in various ways, and a common way would be to replenish the lost volume that people develop over time, and this volume loss can be replaced with either fillers or, more commonly, fat grafting. Fat grafting is a slightly more complex procedure, but will be longer lasting. Some labia majora, or the outer lips, can also be wrinkled over time. An excision of the excessive skin can be done along the edges. Now, the most common request is for the labia minora, or the inner labia. The inner labia can be longer due to developmental anomaly, or just within the normal population. Labias can also change with pregnancies. It is a common request to have the labia shortened, and also to have some hyperpigmented or darker parts removed. There are various techniques that exist for the labia minora reduction, but the most common ones are the trimming technique and the V-shape wedge excision technique. From time to time, the technique for the labia minora reduction will extend into the clitoral hood in order to reduce excess of mucosa in that region. Overall, this technique of labia minora reduction is a simple procedure, usually done under local anesthesia under intravenous sedation. The results are very satisfactory. I believe when it's done with proper planning and in experienced hands, the surgical results for labiaplasty are very gratifying.